Thanks, Sarah, and thanks, Charles. Hi, everyone. My name is Jen Brown with the Office of Research. I know many of you. We're excited today to present some high-level overview of the use of Epic to support research workflows, whether you're new to MCW and new to research or seasoned with the use of Epic. It is something that we need as research teams in order to access data, follow our participants, and help facilitate billing and workflows through all of our daily activities. So I just wanted to highlight, we may have some friends from pediatrics on today. Today, Charles and I are really focusing solely on use of Freighter Epic for research. There are differences between children's instance of Epic and Freighter's instance of Epic and what is and is not allowable, but there are also a lot of similarities as well. So we encourage everybody to raise questions if you have them. It's going to be informal. I'll give some high-level overview and then kick it to Charles to provide some demonstrations. So again, if you have questions, feel free to put them in the chat. But I will give it over to Charles to introduce himself. Charles is a great partner with Theta Care.
Thanks, Jen. Charles Gray, principal trainer and senior education coordinator on the training team. And I've been with Freighter for coming up on 8 years. I've had a variety of experience in Epic and health IT. Happy to be here and looking forward to talking about the research coordinator workflows in the module.
Thanks, Charles. Let's see. So there we go. So to jump into it, high level overview of Epic. As we all know, Epic is our electronic medical record, again, used both at Freighter and Children's. Freighter went live with the Epic research module, which is part embedded within Epic in 2020. And the research module was established to help support clinical research workflows. The intent of the research module is to connect the research studies, the participants, and the clinical care for those who have been around pre-Epic or in the early days of Epic. We would have encounters where, or I shouldn't say, we would have instances where we would have participants who maybe were seen in the TRU, had an infusion, and then ended up in the emergency room later that day. And, oh, I was here for my visit, but that research visit wasn't visible to the ER staff. They didn't know what study the individual was on. So that's where instances like that, the Epic research module really helps give that transparency of information and patient enrollments and statuses to anyone in the enterprise who needs that to know that information, again, whether it's related to billing or emergency medicine or other areas, to know what participants, what research participants may be involved in. So the research module helps us display study details, specific study information, what that participant is enrolled on, who the contacts are, both the PI and any coordinators and staff, and then again, enrollment information, who's enrolled, who may have been approached or screened for a study. As Charles will show, all research orders and participants within the Epic research module have a unique research icon. So again, it's very easy to identify who is on research or where an encounter may be established and linked to the research study. As an organization, we've adopted Encore as our clinical trials management system, and we have integration with between Encore and Freighter Epic to help facilitate communication. I will get to that in a moment. But ideally, the research module makes sure that all of the I's are dotted, T's are crossed, and pieces are connected. So whether it's your research-related orders, your encounters, a research note, everything's linked to the specific study and that helps later follow-up workflows. So many of you may have seen the integration map that we have, how all of our research systems work with one another. I just have a little screenshot of the link between Encore and Freighter Epic. So there is an exchange of information between systems where within Encore, Encore can receive patient demographic information from from Epic, so you're not having to retype every person's name, address, contact information. It maintains that current information. You just have to enter the MRN number and everything pulls in. And likewise, as we call it, the RPE interface, but part of that connection between Encore and Epic pushes information from Encore to Epic. So one of the highlights is letting the systems do the work and avoiding that manual entry, both on the Epic side and in Encore. Let Encore push the data to Epic. So when you enroll John Doe on a study, via that integration, Encore will tell Epic and update John Doe's medical record that he's now a participant on your study. If John Doe comes off study, it will update Epic to update the status accordingly. So that's where we definitely want to utilize those efficiencies and automated efforts to make sure the information is current and consistent and again transparent across the enterprise. Will also mention with that integration, it will map the study team role. So if you are a CRC entered on a study in Encore, it will push and identify you as the CRC for that study in Epic. Moving on, I will bump it to Charles shortly, but one of the things we wanted to highlight today was navigating Epic and some tips and tricks. I know we have some Epic super users, people who have figured this out, but a lot of times study teams and coordinators learn from one another. And I know with a most recent upgrade within Epic, some of the dashboard views have changed, and it also seems like everybody has a different view within Epic. So Charles will highlight some of the things you can do to customize your workspace. So it's specific to you. You can identify what are your favorite reports, who are your favorite participants in studies, and have all of that information available to you on your research dashboard. Also, he'll cover some of the additional tips and tricks, how to easily search within a chart to locate labs, using the filter boxes to narrow those results. Because again, Epic is a very strong tool and we are privileged to be able to have access to this information, but we also need to be mindful of what we're accessing and that it falls within the confines of our IRB approval and specific to the needs of our role. So again, just that reminder, Epic is on a need to know basis. We're only looking at the information we need on the patients we're working with for our research studies. But and then from there, we can highlight some other opportunities, utilizing smart phrases and text to help with consistent and efficient documentation with the system as it relates to notes and managing multiple workflows within the system. So I know I just covered a lot there, but I am going to stop sharing and bump it to Charles, who's going to pull up the playground environment for Epic to highlight how you do some of those things. So if you're logging in remote, you may have Epic open and maybe you feel free to navigate Epic while Charles is also demonstrating.
Great. Thanks, Jen. Can you guys see my screen okay?
Yep.
Awesome. So yeah, Jen's right. We recently got a new dashboard. I believe it was back in November. There was an upgrade. And as a result, some of you may have found it tough to find your dashboard. I'm going to give you a few tips on how to favorite your dashboard and set it as a default so that it's the first, if you so choose, the first activity you see when you first log in. I usually get to the what's called the catalog by clicking on a dashboard title. So if I click on this dashboard title and then search for some keywords, say study team, I know that's part of the title of the dashboard. I can even filter by content type to limit the results even further. But you'll see here that this first result is the research study team, my studies dashboard. And I can go ahead and click the star in the upper right just to favorite it right away so that it makes it a little easier to find later on. But I can also just click the play button there to bring up the dashboard itself. Um, uh, Now, I mentioned that you can set the dashboard as a default. Clicking on that dashboard title again brings up this little sidebar here, and you'll notice that I have a number of uh, dashboards listed as favorites. Um, the research study team dashboard, however, is at the bottom. In order for you to see that when you first log in, you want to drag and drop it to the top of the list so that it's um, the first thing you see when you log in again. And just to keep me honest here, I'm going to log in again as research coordinator, and the first item we should see is that dashboard. Sure enough, here it is, and uh, we have a number of items on the dashboard that you will use from time to time. Uh, Everything from certain reports to there's some inbox items down on the right as well. I've got some reporting workbench favorites listed. Um, so in addition to the dashboard, there are a number of things that you can do to set up some efficiencies with your workspace. The first thing that comes to mind for me is the toolbar up top. Um, Everyone has a toolbar. If you right click on any of these items, you'll notice that you can move them around or remove them entirely. And that's something to consider if you've got some activities that you would like added that are not visible. You may need to free up some workspace up on the toolbar. As research coordinators, uh, certainly the research studies activity and the study maintenance activity are big on the list. There may be others, maybe say uh, protocol builder. Um, you can find those in the search field, but to add them to your toolbar, you'll want to go to the Epic menu in the upper left. And I mentioned, what was it? Protocol builder. That's going to be a ways down in the menu here, but yeah, here we are. If you want to add those items to your toolbar, you would just select the plus sign. Um, and it'll be added to your toolbar. Now, be aware if you've got if you have a lot of items on that toolbar, they're going to get pushed over to that more menu. And here we are in that more menu. Here's my protocol builder. So yeah, do a little work ahead of time in your toolbar, clean up the things that you don't really need. Maybe front load it with items that you use often, and I think you'll save some clicks. One thing I uh, didn't mention with the last few items, chart search, the toolbar, the dashboard, there are some keyboard shortcuts uh, mapped to various functions on those items. Chart search is, of course, the control plus the space bar. Um, it's control plus the space bar. Sorry. Um, the items on your toolbar are mapped to keyboard shortcuts as well. If you hover your cursor over the top, you'll see the keyboard shortcut in parentheses. And then lastly, as far as keyboard shortcuts go, on the dashboard itself, um, you can refresh the dashboard by holding down the Alt key and the equal sign. So Alt equals refreshes your dashboard. You can impress your colleagues in the office with your quick refresh skills on the dashboard. Now there is another way to do it. There's a refresh item in the menu. I think that's more component level, but Alt equals is very handy for refreshing the dashboard there. Looking at my notes here, as you open activities in the in your workspace, we'll take a look at Mr. Archimedes here. And let's see, one more item. I'm just trying to emphasize that as you open activities and maybe reports, patient charts, and that kind of thing, they're going to open as a series of tabs, and so you can navigate your workspace that way. Same thing with the patient list and schedule there. Jen mentioned filters, and that's important because sometimes, especially in this in the research activity, you might come here looking for a study association, and you don't see what you're expecting to see, and more often than not, it is due to the filters up in the upper right here. As you can see, there's an inactive study that I don't have showing right now because the filter isn't populated. If I check that, you can see, sure enough, Leopold declined to participate in this retinal imaging study uh, a while back, and that's showing. So yeah, just keep an eye on those filters on the upper right. They can obscure at times what you are expecting to see in the activity. Um, the research icon we'll see a bit more in just a few minutes, but you can see that next to the words research participant, the patient banner there. Any caregiver in the organization who comes across this patient will see that, and um, they will be able to see sort of a view only study description. Um, they're not part of the study team. What else have I forgotten in terms of navigation tips and tricks?
Something
I
I
think
just saw, Charles, the recruit patient button, which we'll get to momentarily, but I just saw that there, another way to access recruitment.
that's right.
Any
Uh,
questions in the chat?
Jen mentioned chart search for searching the chart for notes or other results. You can use your control plus spacebar for that. Um,
And I just because
Creating and using your own smart phrases uh, is is fairly simple. Um, I can go to my smart phrase activity here um, and manage or edit the smart phrases that I've created already. I can create new ones. Right. Maybe some text here.
for anyone online or in the room, does anyone use smart text or smart phrases?
Yeah.
Yes.
Yes. Yeah. I have like the templated like consent discussion.
Great.
For like certain visits, I have like a template description of what patient's gonna do today. And then we can go through and edit certain sections of things that need to be changed.
Great. Glad to hear your teams are using it. I will highlight last year Epic actually visited campus and it met with some study teams across the enterprise, just how it was more for them to understand how people within the research communities utilize Epic. And one of the points of feedback that we did receive was that there was inconsistency in how coordinators from different units utilized Epic, where, some departments still had shadow charts and, but others were using smart phrases, using research notes. So that's really a goal that we have, to how we can better standardize and have that information readily available.
We do have a request in the chat. They said, I would love to review research labs orders.
Okay, we will get to research lab orders coming up. So Charles, if you wouldn't mind stop sharing, I'm just going to cover our next couple slides and then we'll hand it back to you in a moment.
Pardon me, I'm a bit of a Zoom rookie here.
Same.
Stop sharing. There we go.
You're now a pro.
All right. Back to me. So one of the things we wanted to highlight too, which is an important piece of the coordinator workflow, is encounter linking. Because encounter linking helps improve billing compliance and eliminates rework, not only for our friends in Freighter Oak Creek, but also protecting our participants from receiving erroneous bills, and understanding what pieces of a visit may be specific to the study visit as opposed to standard of care. So encounter linking is not something that is facilitated through the automation between Epic and Encore. This would be a manual step to go in, but if you know your participant is coming in for a visit or you're preparing for that visit, we want to make sure you're taking that extra second to link that encounter with the study. So with that, it helps improve visit accuracy, which leads to billing accuracy. It also, again, ties to any orders or notes. So anything that's involved in that specific order, it is that there's a visual flag. And again, as Charles had mentioned, that little icon for research that highlights that this is specific to this research study. So with this, I know, especially teams, as they've gotten more involved with Encore financials and understanding from a coverage analysis perspective, what is research versus what is standard of care, knowing what aspects of your study are specific to the research. Doing this encounter linking piece is critical to making sure that charges fall in the appropriate buckets that they need to. So I'm going to stop there. I see Betsy and Kitty are both on from Oak Creek. Do either of you have anything to add in this regard? Sorry, I put you on the spot.
No, nothing for me.
Okay.
Me
Other than just encounter linking, it's one of those things. Again, you want to make sure to do that piece to make sure all of the necessary pieces align with your study. So, and Marcia,
Yeah, definitely.
And Marcia, I saw your comment there. Charles will show how to manually link encounters momentarily. I'm just going to cover one additional slide if my computer will behave. There we go. Specific to lab orders, and I know there was a comment about lab orders, which we'll show as well. But using lab orders that to facilitate your research collections, the best practice after we went live with the Epic Research Module in 2020 and 2022 was establishing the Lab 147 or the research lab order to help facilitate research collections. And so by linking these orders to the correct encounter and diagnosis, this identifies that these orders are specific to your study. As we all know, with managing research orders, it's verifying the timing, frequency, especially if you have any special PK draws, special tubes, special processing. You want to make sure that all of that information is available and aligned. With the Lab 147, there is a smart text template that pops up, and that gives you an opportunity to provide a comment and any additional information or special instructions for those who are collecting or processing the lab. And again, I can't reinforce enough that communication is key. There is no such thing as over communication. So if you have the need for lab specimens or any research specimen, coordinating with the appropriate units, whether that's within the TRU, with your specific unit nursing teams, or with the labs who are doing the processing, because we know those samples are liquid gold and you only have one shot. So over communication is way better than not communicating at all. So with that, I will send it back to stop sharing and send it back to Charles, and he can cover the encounter linking and lab ordering.
All right, thanks, Jen. So yeah, encounter linking is fairly simple once you have the report set up and handy. And by that I mean if you look at my reporting workbench favorites here down in the lower right on my dashboard, I've got this report that I've set up called upcoming appointments for patients associated with my, in this case, insomnia study. It's just a study I put together for training purposes a while back, and I've got that report set up for that particular study. Um, when I run that report, I get a couple of patients that that I can then select and link to the research study fairly easily. If I select the patient here on my report, then go up to the toolbar, you'll notice that there's this button for link to research study. That pops open a little window here, and then last step is to click link encounter and then close. And then after that's done, you can see I have some research related info that pops up. We just talked about the icon. Here's a participant ID and study code. There's some additional info down below in the detail pane. I should note if for some reason you need to change this, or maybe you make a mistake, it's as simple as selecting the patient on the report and then clicking the button again, and just toggling it off. And so yeah, you can see all those. I always think this is interesting. This little audit trail down below keeps track of all that activity. But yeah, that's essentially it. Once the report is set up, you select your patient on the report and link to the research study using the toolbar button. Just a note on setting the report up. In your reporting catalog, in the analytics catalog, I'm clicking on the dashboard title. I can certainly search from this search field in the sidebar. I'll say upcoming appointments. I think this one is abbreviated. Or we'll see if that pops up. Yeah, so uh, the report that I'm using is this one right here, upcoming appointments for patients associated with your study. Clicking the pencil icon will allow you to adjust a couple of things. In this case, for encounter linking, I want to see an enrollment status type of active. And then I'm going to point it to the correct study. Right now it's pointing at the imaging study, so I'm just going to cut and paste each of those items and point it at my insomnia study. And you also want to give it a name that is meaningful, that will help you know what the report is pulling. Um, Many times Epic trainers will recommend that you preface your items with your initials. That way, it's just an additional visual indicator to you that that thing you're running or changing or editing, deleting maybe is yours, and it's okay. This last bit, I would just say something like my insomnia study. So this is all just to sort of demonstrate how you would set up the report uh, to link your encounters to. Um, any questions on encounter linking? Um,
There was a question about the edit button. Do you know what part she's referring to?
Charles, there's, Marcia had a question, finding the edit button when she signed a visit note, and maybe there's a typo, but maybe we can cover that when we get to notes.
okay, sounds good. All right. Next up was the lab order, correct?
Correct.
For that, I'm going to create a orders only encounter. We'll work with Mr. Archimedes again here. Um, where am I logged in? Drexel. Okay. Orders. I'm gonna go down to the add order button and add a couple of orders. We'll say metabolic panel. Um, I can't help but share these couple of somewhat obscure click saving tips. You know, if um, you are in this order search window and you've got multiple orders to enter, maybe a good idea to hit that select and stay button. That way you're just not you're not jumping in and out of the order search window here. Um, Another one, this one's, you know, like I say, a little obscure. But since I have some additional orders to enter, you know, my instinct would be to go up and erase the text from that search field that says CMP, but I don't have to do that. I can just start typing, and you know, I've put in my blood count here, and I can arrow up and down, press enter. That pops it over to the right side for that um, select and stay panel. And again, you know, if I have some additional orders to enter, I don't have to erase that text. I can save a step and just start typing whatever it is that I need to add next. So your mileage may vary on that one, but I always like to share uh, just in case. Um, and oops, I forgot the most important one there. Lab 147. Sorry, guys. Uh, and I think I've got a space in there. Here we are. Bear with me. Here we are. Okay, so we'll add lab 147. Here is the lab order, and we need to just confirm our status, specimen source. If it's blood, we would choose blood. Um, and then the comments here have to be filled out as well. So each of the wildcards that you see need to be filled in. I'm just going to pull it out for time purposes, if that's okay, and click accept. Now, to associate these orders to the study, we're going to go up to the options window and select Research Association. And we can associate the orders here. Click accept. And then we have the icons. So we know the orders are associated. Then we would pen these orders, correct? As coordinators. There is this pend and send function. So I could send this over to the provider with a note. And click send and close workspace. Questions on lab orders? I could log in as the provider that we just saw as well, and take a look at the world from his point of view, if you'd like. It's really up to you. But he would be going into his in basket, popping open the orders, and then signing those orders.
I think that's okay, but we did have a question in the chat if it's possible to create an order set for a study for screening. For example, one study requires a CMP, a CBC, lipase, amylase. Instead of entering all four, can they create an order set? I don't know if that's a CRC access, if that option, but I mean.
Yeah, I've not heard of people being able to individually create their own order sets to use. That's typically something that has to be routed through the department or division based on the clinical approach that that group has agreed upon for that particular use. But maybe I'm wrong and it can be.
We'll follow up on that one. And there's certainly an idea. I guess it's a matter of again, access and making sure you're selecting right orders, things like that. But it's not to say it couldn't be done.
Yeah, I think order sets are complicated because they exist kind of in a big bucket that everybody can pull from. And so what the organization doesn't want is everybody having the ability to just create one-offs for their own needs, because then who's monitoring and maintaining those and getting rid of those from a standards perspective. So, but it's definitely worth investigating.
Thanks, Betsy. And Betsy also added to the chat as well regarding the smart text within that lab order functionality, that it can be modified to meet the needs of the coordinator or for that specific order. So again, it's saving you time by having that placement text available for you.
Yeah, thanks, Jen. It was built, originally with input from researchers on what kind of the norm information was, but it's totally, can be modified if it doesn't apply to the study.
All right, Charles, if you want to stop sharing, I'll pick up and then we can do our final demo and hopefully have time for questions.
That's good.
Great. So picking up when it comes to research notes, as we've talked about, utilizing smart phrases and smart text can help. As we know in research, if it isn't written down, it didn't happen. So we got to make sure that we have an appropriate source to highlight and document what was done during study visits, or if anything wasn't done. So research notes can be used within Epic to document research visits or telephone encounters. Again, creating those note types or templates for consistency. As you mentioned, having a consent note template saves you a lot of time and effort rather than recreating the wheel every time, and just having that easily available. Again, making sure, from a compliance perspective, documenting what occurred in a visit, or if any potential deviations occurred, so you have that source, logged within Epic. Since there is a lot of information already in Epic, making sure you're avoiding duplication. You don't need to recreate the wheel every time or, repeat what's already available in the Epic. They can see what labs were done at that visit. You don't necessarily have to put all of those things in, but smart phrases and can pull in items from an encounter if needed. Again, making sure that your notes are short, concise, legible, and can support from a billing perspective, a compliance perspective, and lastly, as a reminder, remembering that notes can be visible not only to the patients because we're documenting in their medical record, but they can be read by anybody. So making sure you're being mindful of what is in that note. And then touching on Epic recruitment tools. So we do have, and again, speaking specific to Freighter Epic at this time, several recruitment tools that can be used to help identify potential participants for your studies. What's really cool is using MyChart. There are over 10,000 Freighter Theta Care patients who have said, yes, I am interested in research in their MyChart. We have a report that can be run with all of those individuals who are interested in study participation, which is fantastic. So these are a great tool to use to recruit for studies. It's not something that can be used necessarily for every study. For instance, the Cancer Center said, we know who our patients are. We're not going to use MyChart recruitment. But if you needed to cast that net and you needed to identify patients depending on whatever criteria, there's an ability to filter those roles down in partnership with the reporting workbench report. For those who aren't familiar with reporting workbench reports, those can also be created to identify potential participants. Again, these are with IRB approval. So there is a form to complete. I have the link there. The link is also available on the MCW HRPP website. But that form, you can spell out exactly what details or items you need in your reporting workbench report. Once it has IRB approval, that report is sent to the MyDA team and they build that report specific to your study. And anyone who's on the IRB has the ability to run those reports in Epic. And you can use those in tandem to, again, help identify who may be interested in your study and then sending an invitation via MyChart. Best practice alerts are also listed. They aren't used as often as teams once thought they would be. Reporting workbench reports actually give you more of a real-time access when you need it, rather than using the best practice alerts. But again, a reminder that for Epic recruitment, these are the only tools that are approved for use with Freighter Epic. Slicer Dicer is not to be used for research recruitment and filtering in Freighter Epic. Children's does allow Slicer Dicer use by research teams. Freighter does not. So I just want to make that very clear, that you can only use the tools for recruitment that we have IRB approval to do so. So, and just very high level back to the MyChart recruitment tool. I actually did a screenshot this morning of my own personal MyChart account. And I keep this one in just for an example, but to show what it looks like to the participant on their side. So I had a ping saying in the purple circle there, you might be a good candidate for a research study. And when I clicked on view study, you get that patient-friendly description, which was IRB approved. This was for the All of Us study, which all of us are familiar with. But with that IRB approved patient-friendly summary, it gives the details of what the study is, who to contact. And at the bottom, there's two buttons. I'm interested in learning more, or no, thank you. If the participant hits no, thank you, that's where it ends. But if they hit I'm interested in learning more, they actually fall to a report to then say, these are participants to follow up on who are interested in your study. So again, this might not be a tool for every type of study or every type of patient population, but it is another opportunity to cast that net and use the tools we have to reach out to our participants when we can. So I will stop there and Charles can walk through how those workflows work, both from the research note and then the research recruitment.
All right. Thanks, Jen. All right, so we're back on Leopold's chart here. To create a note, I'm over on the notes tab in the upper right. Sometimes this can be hiding in the little sidebar here, so just keep that in mind if you're searching for it. But clicking the notes tab and then create note allows you to create a note. And here I can use dot phrases, or smart texts. As well. So keep that in mind. Whoops. Did we had a question about notes earlier? Was it the edit button after saving? Just wanted to make sure we covered that.
Yes, it was after signing it. Sometimes I'm having difficulty finding that edit button because I've actually closed out of the chart. So maybe we can recreate that.
Let's take a look. So signing the note or signing the encounter or
Yes.
just the note?
I guess the encounter. It seems like it's a two-step process. I need to sign the note and then I need to sign the encounter. And otherwise, it's still, when I come back to Epic, it says that, oh, you've still got a note to finish.
All right. Sign the encounter here. I got some wild cards in there. I'm going to take these out. Whoops. And we'll just throw something in there for some text, testing purposes. There we go. So signed the note. Now locating the note again. Let's see. Notes. Where's my notes tab? Chart review. Looks like I got a note here. Huh.
That's where I got stuck.
I think you have to go into the encounter, Charles. So go into chart review. You can't open it from the notes view from the
Oh, sure.
encounter and then open it from there. Click on encounter.
Sorry.
Go back.
Chart review,
Up
encounter.
top, right above internal medicine. Over to the right.
There
Up.
we go.
Go up where it says
Thank you.
encounter. Click there to open it.
There.
Yep,
Okay.
you have
Yeah.
to create an
Mhm.
addendum. That's right.
Oh, okay. Because I went up to the
Thanks
top.
for the assist there.
Can we
You're
try
welcome.
can you try canceling and go up
Yep.
to the top? Because I was going up to the top bar that says encounter, and I was trying to go that way. And that was not working. Above chart review to the left in the
chart.
red
Oh, no.
red area up there.
Yeah, that's
Top
to start
there.
a new encounter. Yeah.
Okay. And that's why I was not getting my previous encounter. Okay, so I have to go down lower. Okay, thank you very much.
We also had a comment in the chat that says, I think you can right click as well. So I don't know if that means you can right click on the note.
Add or addend encounter.
There you go.
So you clicked on the note, the actual note. Okay, edit or
in the
pin
notes
note.
tab in chart review, and then down looks like you can addend.
Yay.
Thanks for the tip.
Love that right click action.
Yes, when in doubt, right click. That's my new motto. Thank you.
Questions?
Can I give you another right click shortcut?
Yeah, you bet.
Of
If you
course.
go into the patient's chart in their appointments,
Okay.
Chart appointment.
you might have to go up to more for appointments.
I see. Appointments.
No, the upper one where it says, yeah, do you have appointments?
No, is that
The
front
appointments is usually one of the ones up there, like with yeah, there you go.
appointment records? Appointments. There we go. Sorry. And pop open Leopold again.
Now go to this appointment here, hover over it, and click right click. You can link research study right there.
Oh, hold that.
Oh,
Hold that. I want to take a screenshot.
gold star.
They train us well in the cancer center.
All right. Beautiful.
Get the tip.
So since you're from the cancer center, can I ask, do you use that lab? What is it? 147?
No, we actually use the clinic research lab, that order.
Yeah,
But-
they have a special similar order in the
And the
Encore
whole
or in the
process.
oncology space.
Yeah, it's we have a whole team dedicated just to doing
Yeah, that's what I heard.
collecting our research labs. Yeah, and like the tubes are play. Yeah, it's very seamless for the coordinator, but there's communication is the big point.
Yeah. So I was told to use that method for my expanded access program. So I'll continue to use that. Okay. All right. Thanks.
Any other questions before we move on to eye chart? Take a look at a couple of the components there.
Yeah, we have about 5 minutes, Charles.
All right, we can do it.
Okay.
So, Jen shared earlier what the patient sees in selecting research preferences, and she also mentioned that as research coordinators or study team members, you can run a report to identify those patients who have said yes, it's okay to contact me about these studies. In the research record, the what's known as the RSH record, there is two pieces that are required for that to work. A patient-facing study name and a description. So if this is something your team is interested in, there is just a tiny process to get this built out, but your team would write up the both pieces, the name and description, send it to an analyst. They get it approved by a patient-facing communications group. Once it's approved, they type it up in the system, and then you would be able to pull it in here. And then the as Jen said earlier, the patient would be able to see the description on their side of my chart. The report is right here. I have it as a favorite. I just ran it. In the training environment, we don't have that integration set up necessarily between my chart and Epic, but this works essentially the same as we saw with encounter linking. We're going to select patients on the report itself, and then click the recruit patient button. And then we would be able to see we would be able to send a recruiting request to those patients. But yeah, that's a bit difficult to see in the training environment. Apologize for that. That integration isn't quite set up. We do have a tip sheet that covers this process that's available in UPerform. Happy to share that if your group is looking to get this implemented.
Yeah, I put a note in the chat too. So usually study teams, if they have any questions about my chart recruitment, I'm happy to meet with them, to screen share, to walk them through it, especially for their first ones. But again, we need to make sure you have IRB approval. And so I help facilitate that process. But for the teams that have used it, and again, depending on the type of study and type of participants you're trying to reach, it has been beneficial. I know we're close on time. Charles, do you mind if I take over and bust through our final
Not at all.
slides? Thank you. And if we didn't cover anything today, if there's something you need us to follow up on, we are more than happy to. But just to end on some highlights. First, we've received a lot of requests about MyChart messaging, not only from study teams, but from research participants, because historically MyChart has been specific to clinical communications only. But if you need to reschedule a study visit or, a reminder to bring a diary, things like that, sometimes communications get lost if you're emailing your participant about the research, but they're coming in for a clinical visit as well. So we heard you. There are discussions underway to allow study teams to direct message participants who are enrolled on study via MyChart. It is not available at this time, but we understand that having that ability to message within Epic and MyChart is beneficial for everyone involved. So again, more to come, but stay tuned that we hear you that that would be a huge benefit for everyone involved in research. Also, you may have heard about Epic Cosmos. Both Freighter and I believe Children's is live as well. Freighter recently went live with Epic Cosmos. If you're not familiar with Cosmos, basically it is a large data set of all or those who've Epic institutions and customers who have opted in to provide their de-identified data to a larger data set. So over 300, maybe that's a typo on my part, a large amount of patient records. I don't know if 300 million is right, but again, it allows the ability to look and do large scale real world research without the risk of any PHI involved. So this is another great opportunity to support our researchers looking at longitudinal data, looking at cohort discovery, and having it in a standardized protected space. So there is a process to get access to Cosmos. It isn't just part of your normal Epic access. It is outside of Epic. So see the Epic toolbox for more info. We do have super users who are available to help facilitate that process. But again, if you hear your investigators talking about data, this might be another opportunity to tap into the Epic Cosmos world. And then I guess just to round up key takeaways, again, utilize that integration between Encore and Epic. Let the systems do the work, that you don't have to do that manual entry twice. Reminder to keep proficient on encounter linking and order linking to your studies, because it saves a lot of time and effort and rework on the back end, and ensure appropriate billing. Our goal as an enterprise is that standardized workflow across. So if it's an opportunity to share smart phrases, to share ideas, how you use Epic, definitely appreciate the dialogue that's been happening today. That's been great. If the opportunity arises that Epic can help you with recruitment tools, let me know. Happy to talk through my chart and reporting workbench. We do have a resource toolbox available on the research training page. So Charles had also mentioned the My Chart piece there for monitor access, for lab ordering. All of that information is on there. But if there's something that isn't on there, that would be a great resource to have. Let us know, and we can certainly add to it. And then also myself, Charles, Betsy, others are part of an Epic Research Stakeholder Group. We just met this morning, actually. So if there's questions, if you have ideas, again, the My Chart messaging was one that came across our committee. Or if there's issues, let us know, because that's something we can bring up, and we may not have the answer, but we can escalate to the powers that be to get an answer. So again, we have a great tool with Epic, and hope today helped.
Awesome. Yeah. Do you know, for the My Chart messaging, is that discussion including the children's space, or is that completely off the table still for children?
That's a great point. My understanding it is off the table for children's, that it would be specific for Freighter My Chart messaging. Great question. I know we're at time, but any other questions in the chat at all? Charles, thank you so much.
Of course, thank you.
Thank
It's my
you very
pleasure.
much.
Great to see you as always.
And thank you everybody for your questions and your extra tips. Those are always very much appreciated. Thank you, Jen. Excellent.
Thanks, everybody. Have a great day.
Thanks,
Thank you.
guys. Have a great day. Bye-bye.